In the dim light of an understaffed intensive care unit in Massachusetts, a heart monitor flatlines while a nurse frantically searches for a working defibrillator. The life-saving equipment had been repossessed weeks earlier due to unpaid vendor bills, leaving medical staff to perform manual compressions as precious seconds slip away. This was not a tragic anomaly in a forgotten rural clinic, but a daily reality inside what was once America's largest private for-profit hospital system. When Steward Health Care filed for Chapter 11 bankruptcy, it sent shockwaves through vulnerable communities across several states, threatening to sever access to essential medical services for millions. 31 hospitals were suddenly pushed to the brink of closure, leaving pregnant mothers, chronic disease patients, and trauma victims wondering where they would go when the doors finally locked. The collapse of this massive healthcare network was not caused by a sudden drop in patient demand or an unavoidable natural disaster. The true cause of the catastrophe was engineered meticulously in distant boardrooms, beginning over a decade earlier when the private equity behemoth Cerberus Capital Management set its sights on the healthcare sector. In 2010, Cerberus acquired Caritas Christi, a struggling nonprofit Catholic hospital system in Massachusetts, for $895 million. The firm promised to save the failing network, injecting capital, preserving jobs, and maintaining vital community services under a newly minted for-profit entity named Steward Health Care. Yet, financial analysts and healthcare economists viewed the acquisition through a much darker lens, recognizing the classic hallmarks of a predatory corporate takeover. Private equity firms operate on a mandate to maximize short-term returns for their investors, a fundamentally misaligned goal when applied to the long-term, life-or-death realities of community healthcare. The rescue operation was, in reality, a sophisticated financial extraction mechanism designed to siphon wealth from the hospitals before the inevitable collapse. To execute this wealth extraction, Cerberus utilized a controversial maneuver known as a sale-leaseback transaction, fundamentally altering the financial foundation of the hospital network. In 2016, Steward Health Care sold the valuable real estate beneath its hospitals to Medical Properties Trust, a real estate investment trust, for $1.25 billion. Steward no longer owned its buildings. Instead, it was forced to lease back the very operating rooms and emergency departments it had occupied for decades. This transaction immediately burdened the hospitals with crippling, inescapable rent payments, transforming previously owned assets into massive, recurring liabilities. The infusion of cash from the real estate sale did not go toward improving patient care, upgrading surgical suites, or hiring more nurses. Instead, hundreds of millions of dollars were funneled directly to Cerberus and its investors as debt-funded dividend payouts, leaving the healthcare facilities hollowed out and financially starved. The quiet decisions made during that real estate transaction echoed through every ward, shaping the daily reality for thousands of healthcare workers. Nurses and doctors arrived for their shifts to find a deteriorating environment where basic supplies like IV fluids, syringes, and sanitary wipes were chronically out of stock. Maintenance requests for leaking roofs and broken elevators were ignored, as the hospital's operational budget was entirely consumed by the crushing weight of its new rent obligations. For the patients relying on these facilities, the financial starvation translated directly into prolonged suffering and preventable tragedies. Wait times in emergency departments skyrocketed, and patients requiring urgent psychiatric care were routinely boarded in hallways for days because specialized units had been quietly shuttered to cut costs. The human cost of asset stripping became undeniable as families watched loved ones languish in neglected wards while corporate executives celebrated record-breaking dividends based on artificially inflated EBITDA, their earnings before interest, taxes, depreciation, and amortization. Rather than stabilizing the core Massachusetts hospitals, Steward used the remaining proceeds from the Medical Properties Trust deal to aggressively expand its footprint nationwide. The company acquired struggling hospitals in states like Texas, Florida, and Utah, applying the exact same playbook of selling off the real estate to fund further rapid expansion. This illusion of growth masked a deeply unstable foundation, creating a sprawling, heavily indebted healthcare empire built entirely on predatory lease agreements. State regulators and public health officials remained largely blind to the impending disaster, hampered by outdated oversight laws that failed to account for complex private equity structures. In Massachusetts, authorities lacked the statutory power to demand transparency regarding the massive management fees and dividend recaps that Cerberus was quietly extracting from the hospital system. The regulatory void allowed the firm to operate with impunity, shielding its most aggressive financial engineering tactics from public scrutiny until the damage was irreversible. The echoes of that regulatory failure resonated across the broader healthcare landscape, signaling to other investment firms that community hospitals were ripe for exploitation. As Steward's debt load compounded, the entire network began to buckle under the strain of exorbitant rent payments and mounting interest. The systemic vulnerability of for-profit healthcare became glaringly apparent, as a single corporate entity's aggressive growth strategy threatened to destabilize the medical infrastructure of multiple states simultaneously. Financial records eventually revealed the staggering scale of the extraction, prompting intense scrutiny from investigative journalists and healthcare advocates. Reports indicated that Cerberus Capital Management walked away from its decade-long involvement with Steward Health Care, having generated roughly $800 million in profit. This massive wealth transfer was achieved not by improving the quality of medical care, but by systematically dismantling the financial security of the hospitals themselves. The firm officially exited its investment in 2020, transferring its controlling interest to a group of Steward physicians in a complex transaction that provided the illusion of local control. However, the shadow of that initial strategy still loomed over every facility, as the physician-led management team inherited a hollowed-out company drowning in lease obligations. Cerberus had successfully executed its exit strategy, shifting all the accumulated risk onto the doctors, the patients, and the communities they served. Left to navigate the wreckage, the remaining hospital administrators faced a daily battle against financial insolvency and physical decay. Exterminators were called to clear bat infestations from intensive care units, while surgical teams were forced to cancel operations because sterile instruments were unavailable. Vendors, exhausted by months of unpaid invoices, simply stopped delivering critical medical devices, oxygen tanks, and life-saving pharmaceuticals, plunging the hospitals into a permanent state of triage. Dedicated medical professionals were pushed to their breaking points, forced to practice medicine in conditions that violated their fundamental ethical oaths. Whistleblower testimonies from anonymous nurses painted a grim picture of extreme understaffing, where a single registered nurse was often responsible for double the safe number of critically ill patients. The moral injury inflicted on these frontline workers was profound, as they were forced to bear witness to the tragic consequences of corporate greed every single shift. The ultimate price of this financial engineering was paid by the patients who trusted these institutions with their lives. In one harrowing incident, a mother died shortly after childbirth because the hospital lacked a specialized, functioning piece of equipment that had been repossessed by an unpaid vendor. These catastrophic outcomes were not medical failures. They were the direct, predictable results of a business model that prioritized debt-funded dividends over basic patient safety and operational readiness. The inevitable collapse finally materialized when Steward Health Care officially filed for bankruptcy, leaving a trail of shattered communities and billions of dollars in unresolved debt. The filing exposed the fragile reality of the American medical system, demonstrating how easily critical infrastructure can be dismantled by unregulated financial speculation. Lawmakers and public health officials were left scrambling to manage the fallout, desperately searching for buyers to prevent the immediate closure of vital emergency departments and maternity wards. The bankruptcy proceedings laid bare the catastrophic loopholes in state and federal oversight that permitted such aggressive wealth extraction to occur in the first place. Legislative hearings revealed that regulators had virtually no mechanism to prevent a private equity firm from selling off a hospital's core assets and pocketing the proceeds. The realization sparked composed outrage among policy wonks and citizens alike, demanding immediate structural reforms to prevent healthcare facilities from being treated as mere real estate plays. Industry analysts now point to the Steward collapse as the definitive cautionary tale of private equity's quiet takeover of healthcare. The catastrophic failure of this network proves that the high-stakes, debt-heavy tactics of leveraged buyouts are fundamentally incompatible with the mandate to provide safe, reliable medical care. When the primary objective is generating a rapid return on investment, The essential needs of the patient are inevitably sacrificed on the altar of corporate profitability. Even in bankruptcy, the complex financial instruments implemented years earlier continued to dictate the fate of the failing hospitals. Medical Properties Trust, holding the leases to the physical buildings, maintained significant leverage over the restructuring process, complicating efforts to transition the facilities to non-profit ownership. The master lease agreements, designed to guarantee absolute returns for the real estate trust, acted as a poison pill, deterring potential buyers who refused to inherit the crushing rent burdens. As the legal battles raged in bankruptcy court, the frontline workers who had sacrificed so much were left completely unprotected. Thousands of nurses, technicians, and support staff faced the terrifying prospect of imminent layoffs, lost pensions, and canceled health insurance. The betrayal was absolute. The very people who had held the crumbling system together through sheer willpower were now treated as unsecured creditors, standing at the back of the line behind the massive corporate entities that caused the crisis. For the communities surrounding these hospitals, the fear of losing their local emergency room became a terrifying daily anxiety. Pregnant women in rural areas suddenly faced the prospect of driving over an hour to deliver their babies, while elderly patients with chronic heart conditions lost access to their trusted specialists. The quiet decisions made to maximize those EBITDA metrics had successfully severed the vital lifelines that millions of vulnerable citizens relied upon for basic survival. The fallout has finally forced a reckoning in state legislatures, prompting a frantic push to draft laws that would ban the specific financial tactics used to hollow out Steward. Lawmakers are now proposing strict limits on sale-leaseback transactions in healthcare and demanding total transparency regarding private equity management fees. Yet, these legislative efforts offer little comfort to the communities whose hospitals have already been driven into insolvency by a decade of unchecked corporate extraction. The lessons from that acquisition never faded, serving as a dark blueprint for understanding the true cost of financialized medicine. The story of Cerberus Capital Management and Steward Health Care is not merely a tale of a failed business venture. It is a stark indictment of a system that allows essential public health infrastructure to be commodified and stripped for parts. It forces a critical examination of who exactly is allowed to profit from the sick and vulnerable. As the dust settles on America's largest hospital bankruptcy, the empty wards and shuttered emergency rooms stand as monuments to a profound regulatory and moral failure. The wealth extracted from these communities will never be returned, and the lives lost to broken equipment and chronic understaffing can never be restored. The collapse demands absolute accountability, challenging us to build a healthcare system where the preservation of human life is never subordinated to the relentless pursuit of private equity profit.